My name is Dr. Brian Gross. I work for LewisGale Physicians. I serve here as an otolaryngologist, head and neck surgeon. I've been here for about 3 years. Thyroids is one thing that I have a great passion for treating. We work closely with primary care doctors, endocrinologists, as well as ENT on evaluating and treating patients with thyroid nodules or enlarged thyroid. Most of those patients that have big thyroids and nodules are going to be benign or not cancerous. But it's my job to figure out who has concerning nodules and who needs further treatment. This is really, I would say, a state-of-the-art, comprehensive care of the patient with thyroid nodules. Do everything from the needle biopsy, ultrasound imaging, interpretation of that, of the results, and then ultimately for the patients that need their thyroid removed, make the decision of how much of the thyroid needs to be removed, and then perform those surgeries. And then follow these patients afterwards to see them through to be sure that if it is a cancer, we get it completely treated and cured. And if it's not, that we get them on the appropriate medical therapy. Most people that have thyroid problems in terms of nodules are completely asymptomatic, so they don't even know they have them. And the most common way that we're finding them these days is that people are getting CT scans and x-rays and MRIs for completely unrelated things, but it happens to also visualize the thyroid, which sits right in the lower neck. And then the radiologist or the primary care doctor will see the images and see the thyroid nodule. And that's the most common thing that sends people to my office for evaluation of those nodules. There's other presentations though. Some people will feel a nodule or a mass on one side of their neck. Sometimes people will have difficulty swallowing, or even sometimes get short of breath, and some fullness in the neck. And that can also be related to the thyroid. The thyroid has two lobes to it. There's one on the right side, one on the left side, and then the isthmus that's right in the middle and connects the two. So I have to make the decision in these types of operations of, do we just need to remove part of the thyroid? Do we need to remove the whole thyroid? Removing the thyroid is a surgery, obviously, but is one that I do very commonly. Obviously, with any individual patient, it's a big deal because it's their neck, their thyroid. So we want to give them the optimal care. The majority of patients that we do thyroidectomy on actually go home the same day. When we have to remove the whole thyroid, most of those patients stay in the hospital, but only for one night. People are back eating and drinking and talking the day of the surgery. It is about a 2-hour surgery, so being under anesthesia for that long makes you a little weak. But most people are back up on their feet within literally a day or two. It's a common surgery, but it does require a lot of training. While I was at Mayo, I spent 5 years there, each of those years doing many thyroid surgeries. When I got to the end of my residency, at the end of the 5 years, my mentors knew that I was very interested in thyroid surgery, and I was invited to be the primary author of a chapter in a review book, specifically on endocrine surgery. So that allowed me to study the thyroid in more detail, and then that was ultimately published. And then since being here, I'd say about 50 to 75 thyroid surgeries that I've done each year over the last 3 years that I've been here.